Hello, my name is Trina Rose Cerezo Fox, and today I'll be performing the skill video of a head-to-toe assessment. Here is my badge for verification, and I will start by entering my patient's room, closing the curtain for patient privacy, hand hygiene, and gloves. And hello, my name is Trina. I'll be your nurse today. Can you please verify your full name and date of birth?
Abilene Cerezo Kirtley, date of birth is 8/7/63.
Thank you, and I'll verify with your wristband. Perfect. And upon entering my patient's room, they do seem to be in no distress. They are seated comfortably, and I will go ahead and proceed. So today we're performing a head-to-toe assessment, and it's just as it sounds. I'll start with assessing from your head, and we'll work our way down to your feet. Is that okay with you?
Yes.
Okay. And so I will go ahead and start with assessing the scalp area, and we'll just check if there's any missing hair or thinning of the hair. Okay, and that seems okay. And then I will also just assess your skin, just checking for any abrasions, lesions, rashes, lumps. So I'll go ahead and check. Okay, good. And I would just assess the back area and the front, and there doesn't seem to be any abnormalities, no bruising either. And next I will check for skin turgor. So I'm just going to pinch right here, and there is no dehydration present. And then next I will go ahead and check patient's nails. Okay, and then also on your feet. Okay, and there doesn't seem to be any cracking or denting. So we did hair, skin, and nails, and next we will go ahead and assess the overall face. Everything does appear to be symmetrical, eyes, nose, and then I'll go ahead and just palpate here, and trachea is all symmetrical. And so then I will assess conjunctiva. I'm just going to press down here. Conjunctiva is pink and moist, and the sclera is white. Next, I will check with the pen light. Okay, pupils are equal and round and reactive to light, and accommodation will come next. Go ahead and follow my finger. Okay, and accommodation. Next, we will inspect the nose. So go ahead and tilt your head up a little bit. Okay, nares appear to be patent with no abrasions or abnormalities there. Next, I will assess the ears. Okay, and for ears, there is no excess drainage or excess wax buildup. And are you in any pain?
No.
Okay, and then I will also check the vital signs, which will include the blood pressure, pulse, temperature, respirations, and pulse ox reading. And all those are within normal limits. And then next I will check my patient's lips and mouth. So mouth does appear moist and pink, and go ahead and open your mouth. Okay, teeth and gums are okay. There's no cracks or any abnormalities. I'll go ahead and check with the pen light. Okay, and stick your tongue out. Say ah.
Ah.
Okay, and then for the oral and buccal mucosa, it is pink and moist. Tonsils, uvula, tongue are all normal. And then I will go ahead and palpate just around your face. Just tell me, do you feel any pain or tenderness?
No.
Okay, and the sinuses, there are no tenderness. And next, I will go ahead and test your shoulder strength. So go ahead and shrug your shoulders. Okay, good. Shoulder strength is strong. Next, we will go down to the respiratory system. So I will just assess my patient's breathing. Does appear to be normal. I will go ahead and check for the symmetry of rise and fall. And go ahead and take a deep breath. Okay, and breathing is symmetrical. Next, I will listen to lung sounds. Okay, go ahead and breathe, take breath. Okay, and now we'll check the posterior side, so I'll check your back. Okay, and 2 more. Okay, and lung sounds appear to be normal. There are no adventitious lung sounds. And have you experienced a cough recently?
No.
Okay, no cough. Next, we will go ahead with the cardiovascular system. So I will listen to your heart sounds. Okay, and then heart sounds S1 and S2 are audible with no extra heart sounds. And then I will go ahead and assess the different areas of the pulse. So we will check your radial pulse. Okay, radial pulse is +2 bilaterally, and we'll check your tibial pulse. Tibial pulse +2 bilaterally, and then the dorsalis pedal pulse is bilaterally +2. And then we will check capillary refill. I'll go ahead and press it on your fingernails. Okay. Upper extremities for the hands, there is less than 3 seconds cap refill, and we'll check on the toes as well. Okay, for lower extremities, cap refill is less than 3 seconds also. So that was for cardiovascular. Next, we will move on to gastrointestinal. So I will go ahead and just inspect your abdomen. There doesn't seem to be any abnormalities, no lesions, no scars, no rigidity, no distension. And so now I will go ahead and listen to your bowel sounds. Bowel sounds are audible in all 4 quadrants, and they are normoreactive. And next, I will go ahead and palpate. And so I'm just gonna press and just feel if there's any tenderness. Okay, does that feel okay?
Mm-hmm.
All right. And have you had any troubles with bowel or bladder?
No.
And when was your last bowel movement?
This morning.
Okay. So those are all within normal limits as well. Next, we'll move on to musculoskeletal. So we will, I'll have you go ahead and raise your arms and do some arm circles. Okay, and go ahead and put your arms like this. And then I'm gonna have you pull towards yourself. Good, push towards me, good, push out and push in. Okay, good, grab my fingers. Great, okay. And patient's upper extremities are strong and range of motion is good. Next, we'll go to lower extremities. And then I'm just going to assess if there's any edema. No edema present. And then go ahead and kick your legs out just a bit. And then go ahead and bend your feet like this, your ankles, and then do ankle circles. Okay, good. And then go ahead and press toward yourself, press down, good. And then you can relax your feet down. And then next I'll have you press your legs outward and inward, good. Okay, lower extremities for this patient are also strong and within normal limits. Let's see, are you experiencing any joint pain?
No.
Any pain in general?
No.
Okay, good. No joint pain. So next I will have my patient stand up. Okay, and are you able to, do you feel comfortable? Do you use any walking aids at home?
No.
Okay, are you able to bend down and touch your toes? Okay, good. Come back up. So patient's back mobility is good. I'll have you take a few steps forward and a few steps, and then you can turn around and walk back to the chair. Okay, perfect. Go ahead and have a seat. Thank you. And patient's gait is steady and balanced, as well as back mobility is good. And at this point, I would provide any patient education that is necessary for them in this case. Also, can you repeat your name and date of birth to me?
Abilene Cerezo Kirtley, date of birth is 8/7/63.
And good. Do you know what city we're in?
Sacramento,
Okay, and then do you know why we're here?
for a physical.
Good. All right, so my patient is alert and oriented ×3, and their Glasgow Coma scale is 15, which is the highest it can be, so they're doing good there. And I believe that would conclude our video. I'll make sure my patient is in a comfortable position. The bed is low and locked, and their call light is nearby. Do you have any questions?
No.
Okay, so at this point I would remove my gloves, perform hand hygiene, and document my results.